Hi everybody, I am Naufal. Welcome to my channel. Today we are going to discuss regarding pernicious anemia. So we know different types of anemias are there, like iron deficiency anemia, aplastic anemia, sickle cell anemia. Like that, one type of anemia is pernicious anemia. Pernicious anemia is caused due to the deficiency of vitamin B12. Due to the deficiency of vitamin B12, this type of anemia is caused. Pernicious anemia is caused due to the deficiency of vitamin B12. It is a question for your exam. Due to which vitamin deficiency pernicious anemia is occurring, that is vitamin B12. Another name of vitamin B12 is cyanocobalamin, also known as extrinsic factor. Another name of vitamin B12 is cyanocobalamin, also known as extrinsic factor. These are the another names of vitamin B12. Now regarding the richest source of the vitamin B12 is meat and liver. Meat and liver are the richest source of vitamin B12. Even though vitamin B12 is present in the citrus fruit and in the dried beans, but the richest source is meat and liver. Due to this, among the pure vegetarians, most commonly we can see pernicious anemia. It is a question for your exam. Among the pure vegetarians, which type of anemia we can see? No doubt it is pernicious anemia, because the richest source of the vitamin B12 is meat and liver. Pure vegetarians are not taking meat and liver. So among them, the most common anemia is pernicious anemia. Now regarding the clinical feature of the pernicious anemia is very important for your exam. Red beefy tongue. Red beefy tongue is the clinical feature of pernicious anemia. So for your exam, they will give the question, such and such person is admitted in the hospital and he is having weakness, fatigue, and his vital signs is such and such, like that. And in that, they will give red beefy tongue is present. What is the diagnosis? No doubt if you are seeing red beefy tongue, the diagnosis is pernicious anemia. Now regarding the confirmatory test of the pernicious anemia, it is a repeated question for your exam, that is Schilling test. Schilling test is the confirmatory test of pernicious anemia. Now in our body, in the stomach, it secretes intrinsic factor. Stomach is secreting intrinsic factor. The function of the intrinsic factor is to absorb the extrinsic factor. The function of the intrinsic factor is to absorb the extrinsic factor, that is vitamin B12. The function of the intrinsic factor is to absorb the extrinsic factor, that is absorb the vitamin B12. Due to any infection or inflammation or any surgery in the stomach, deficiency of intrinsic factor will occur. Stomach is secreting intrinsic factor. Due to any infection or inflammation or surgery in the stomach, deficiency of intrinsic factor will occur. If the deficiency of intrinsic factor is occurring, decreased absorption of the extrinsic factor, that is decreased absorption of the vitamin B12 will occur, because intrinsic factor is absorbing the vitamin B12. Due to the deficiency of intrinsic factor, decreased absorption of the vitamin B12 will occur. It will lead to deficiency of vitamin B12 in the body. It will lead to pernicious anemia. Got it? So regarding the exam, another question is, after any gastric surgery, what is the complication? So one of the complication of gastric surgery is pernicious anemia, because intrinsic factor will be less. Now regarding the management of the pernicious anemia, usually we can manage the condition with the diet. With diet we can manage the condition. Also we can give the supplements, vitamin B12 supplements we can give in the form of tablet as well as injection. That's all regarding pernicious anemia. We will meet soon with another video. Till that time, thank you and goodbye.